Hello, this is Dr. Harshni. Today we are going to see the examination of sensory system. Before examining, we should know how these sensations are carried to your cerebral cortex. Sensations from the body and face are carried through different tracks. The sensations from the body, they are carried via two different tracks. They are dorsal column tract and the spinothalamic tract. So the dorsal column tract is otherwise called posterior column tract. The spinothalamic tract is again divided into anterior or ventral spinothalamic tract. The second one is lateral spinothalamic tract. So the dorsal column tract, it carries sensations like fine touch, tactile localization, 2-point discrimination, vibration, stereognosis and appreciation of passive movements. The anterior spinothalamic tract, it carries sensations like crude touch and pressure. The lateral spinothalamic tract, it carries sensations like pain and temperature. Let's see briefly about the dorsal column tract. This picture is taken from Guyton. In dorsal column tract, there are three order neurons. The cell body of the first order neuron is in dorsal root ganglion. The peripheral process, they carry sensations from the receptor, and the central process are carried through the spinal cord up to the medulla. Here you can see the sensations from the lower part of the body, they are carried medially as fasciculus gracilis, and the sensations from the upper part of the body, they are carried laterally as fasciculus cuneatus, and they end in the nucleus gracilis and nucleus cuneatus, which forms the second order neuron. So the axons of the second order neuron, they cross to the opposite side and they ascend upwards up to the ventroposterolateral nucleus of the thalamus. So from here the third order neuron arises and it reaches your cerebral cortex, that is your somatosensory cortex. So to sum up, the sensations of the dorsal column tract like fine touch, 2-point discrimination, tactile localization, vibration, stereognosis, sense of position and appreciation of passive movements, all these sensations are carried via this pathway and it is perceived in the cerebral cortex. Now we are going to see about the anterolateral system. We know the anterolateral system is again divided into anterior or ventral spinothalamic tract and lateral spinothalamic tract. So here also we have three order neurons. The first order neuron, the cell body of the first order neuron is in the dorsal root ganglion, and the second order neuron, it arises in the same level of the spinal cord itself. The third order neuron arises in the thalamus. So we know the cell body of the first order neuron is in the dorsal root ganglion. The peripheral process, it carries the sensations from the receptor, and the central process, it reaches up to the dorsal horn of the spinal cord. From here the second order neuron arises and it crosses to the opposite side and it ascend in the ventrolateral column of the spinal cord. That is, the crude touch, the sensations like crude touch and pressure, they are carried via the ventral column of the spinal cord, and the pain and temperature, they are carried in the lateral column of the spinal cord. So they are ascending upwards up to the thalamus. From the thalamus, that is the ventroposterolateral nucleus of the thalamus. From the thalamus, the third order neuron arises and it reaches your cerebral cortex, that is the somatosensory cortex. Now let's see the concept of dermatome in sensory system examination. A dermatome is an area of skin which is mainly supplied by a spinal nerve. So here the C2 to C4, it supplies the skin of the neck, and C5 to T1 supplies mainly the arm. T2 to L2 nerves supply the chest and abdomen, and L3 to S1 supply the skin of the legs, and S1 to S4 supply the groin region. So when there is loss of sensation in a particular dermatome, we can trace out the nerve which is affected. We have seen how the sensations are carried from the body. Now we are going to see how the sensations are carried from the face. It is carried by the trigeminal nerve. We have three divisions of trigeminal nerve. They are ophthalmic division, maxillary division and mandibular division. They are carrying the sensations to the trigeminal ganglion. Okay. So from here the first order neuron arises. The proprioception is carried to the mesencephalic nucleus. touch and pressure sensations are carried to the main sensory nucleus, and pain and temperature are carried to the spinal nucleus. Okay. So this forms the second order neuron. These mesencephalic nuclei, main sensory nucleus, spinal nucleus, they are present in the brain stem, that is mesencephalic nuclei in the midbrain, main sensory nucleus in the pons, and spinal nucleus in the medulla oblongata. Now the axons of the second order neurons, they all these are going to cross to the opposite side, and they reach the ventroposteromedial nucleus of the thalamus. Okay. So they are reaching the ventroposteromedial nucleus of the thalamus. From there the third order neuron arises and it reaches the cortex.
Hello everyone, I am Dr. Vinita and this is Dr. Naina. Today I shall be teaching you the examination of the sensory system. It is broadly divided into 7 categories. First of all, it is the testing of the tactile sensibility or the touch sensation. In this we have 4 headings, that is fine touch, crude touch, tactile localization and tactile discrimination. The second test is for the pain sensation. The third one is for the thermal sensation. Fourth one is for the sense of position and appreciation of the passive movements. The fifth test is for stereognosis. Sixth one is the vibration sense, and lastly it is about the abnormal sensation. Now there are certain precautions that we have to take before starting off with the examination of the sensory system. We should always instruct the subject as to what we are going to do. Secondly, we should always ask the person, we should always test both the points, that is corresponding points on both sides of the body. Then most of the tests require the subject to have closed the eyes, so we should instruct accordingly. And lastly, we should also give negative tests, otherwise the patient or the subject will continue to say that he has been sensing the stimuli. Then, before we start off with the actual examination, we have to test the sensory part of the cranial nerves as well. This includes testing of the olfaction, that is olfactory nerve, secondly the optic nerve, then the trigeminal, only the sensory part, that is which includes the touch, pain, temperature, corneal and the conjunctival reflex. Then the facial nerve, also only the sensory part, that is the taste sensation has to be tested. Then vestibulocochlear nerve and the glossopharyngeal nerve. Okay, so we start off with the first test, that is to test for the tactile sensibility. The first heading in this tactile sensation is to look for the fine touch. Okay, for this we would use a piece of cotton wisp. A cotton wisp is used and we would touch on different parts of the body. That is, we have to touch the corresponding areas on both sides of the body, and the subject is asked to close the eyes and she should recognize or appreciate the sensation as I am touching it, and whenever she feels the sensation she has to say yes. Okay, now ask the consent. And can I start?
Yes.
I will be touching with this cotton wisp on various areas. If you feel anything, you have to say yes.
Okay.
Okay.
Yes. 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 Yes.
Okay. So similarly, you have to do on all parts of the body. That is face, upper limb, lower limb, trunk, both right and left, and anterior and the posterior areas. That is about the fine touch. Now the second test is crude touch. For this we need a blunt object. We can use the pencil bag or something, any blunt object can be used, and it is similar to what we have done earlier. We will be touching on the corresponding areas on both sides of the body. Same thing, face, upper limb, trunk and the lower limb, anterior, posterior, right and left. And again we will ask the subject to say if the person can appreciate the sensation. Okay? So please close your eyes.
Yes. 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 No. Yes.
So amidst this you have to do negative test also. Otherwise the person will continue to say that the person can sense the feeling, the stimuli. Okay. So that was about the second test. The next test is tactile localization. So what we do is we will place a wisp of cotton on various parts of the body, corresponding areas on both sides of the body, and we will ask the subject to point out as to where I have placed the cotton. Okay, so you will have to close your eyes and I shall be placing the wisp of cotton in various areas, and then you have to point out as to where I have placed the cotton. Okay, so please close your eyes. So similarly, we have to do it on the entire body, face, upper limb, lower limb and the trunk. So that was about tactile localization. Now coming to the next test, tactile discrimination. For this, we would use an instrument, that is either Weber's compass or dividers, because we are trying to stimulate the person with two stimuli, and the person should simultaneously sense whether there are two stimuli or a single stimuli. Okay, so usually the receptors in the fingertips are very dense. So even if the distance between the compass limbs are close by, they can perceive it as two different points. But with the same distance, if I am placing it on other parts of the body like upper limb or the trunk, the person will perceive it as only single point. Okay, so now let's see if she can perceive it as a single point or 2 points. So you will have to close your eyes, and I shall be placing the compass on various parts of your body, and you will have to say whether you can feel it as a single stimuli or two stimuli. Okay, so please close your eyes. Okay, so I am reducing it to a very small
2.
Yeah. So here the distance is less than 0.5 centimeter, yet the person is able to perceive it as two different points. Okay.
Single.
Now I place the same thing on her forearm, but she is able to perceive it as only a single point. So that is the difference, because the receptors are densely packed at the fingertips and very broadly packed here. That is, they are very less, very sparse in the other parts of the body. So similarly, if you are placing it on the trunk or anywhere else, the distance has to be made further apart. Now we can increase the distance, and let's see if she can perceive it as a single point or 2 points.
2 points. 2 points.
Okay. So we have to do it in other parts of the body with increasing the distance or decreasing the distance. Here we can make out the tactile discrimination ability of the person. Now coming to the applied aspect here, there is anesthesia, hyperesthesia and hypoesthesia. Anesthesia is no sensation at all, hypoesthesia is decreased sensation, and hyperesthesia is increased sensation of whatever stimuli we are placing. Now all the touch sensations are carried by the dorsal column except for crude touch, which is carried by the anterior spinothalamic tract. Now we move on to the second test, that is to test the pain sensation. So here we again have two different tests, that is to test the superficial pain and the deep pain. For superficial pain, we use a pin, and we do the same procedure like we have done for the touch sensation. We will place it on corresponding points on both sides of the body, and we should ask the person whether she can perceive the pain or not. Okay, so please close your eyes. Okay, and I shall be placing it on different parts of your body, and please say yes if you can feel.
Okay.
Okay.
Yes. 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 Yes.
Okay. So similarly, we have to do on all the parts of the body: trunk, upper limb, both lower limbs and the face. So that was about the superficial pain. For the deep pain, what we do is we would squeeze the arm muscles and see whether she can perceive it or not. Okay.
Yes.
Yeah. So she can perceive the deep pain as well. Similarly, in the lower limbs, we can squeeze the tendoachilles tendon, and we can see whether she can perceive the deep pain or not. Now the applied aspect here is we can have analgesia or hyperalgesia. That is, increased pain is called as hyperalgesia. Analgesia is no sensation of the pain. So pain sensation is carried by the lateral spinothalamic tract. Moving to the third test, that is to test for the thermal sensation. Here we use two test tubes filled with warm and cold water, and we shall be doing the same thing, that is we would place the test tubes on various parts of her body, corresponding areas on both sides of the body. Okay. Now I shall be placing test tubes, and you have to say whether you can feel it as warm or cold.
Okay.
Okay. close your eyes.
Yeah. Warm. Cold. Cold.
Yeah. So she is able to perceive the temperature sensation rightly. Again, temperature is carried by the lateral spinothalamic tract. The next test is to test for the joint sensation and the sensation of the position. To test the joint sense, what we do is we would hold the any joint can be used, but here for comfortable situation we are using the upper limb. So what we do is look the other way, and I shall be changing the position of any of the joint. So what we do here is we will hold the middle phalanx of the mid finger, and we will alter the distal phalanx, the joint here. Okay, so this is up.
Okay.
And this is down.
Okay.
Okay, so I shall be changing the movement, and finally I shall keep it in one particular position, which she has to say whether it is up or down. Okay, so ready?
Yeah. Up. Down.
Okay, and this can be done in a randomized manner. You can repeat up or you can repeat down. So similarly, you can do it on all the other joints to test for the joint sensation. The next test is for the sensation of position. Here what I would do is I would keep her arm in a particular position, and she has to simulate. She has to do the similar position with the other arm. Okay, so she has to imitate the same position. Okay, so I should be making a position with your right limb. You have to do the same thing with the other limb. Okay, so close your eyes. Yeah. Okay, so she is imitating the same thing. That means her sense of position is also normal. So sense of position in joint sense is carried by the dorsal column pathway. The next test is to test the stereognosis. Stereognosis is the ability to recognize familiar objects like pen, pencil, keys, mobiles, etc. with the help of her touch and pressure receptors. So to test this, what we do is we will place certain familiar objects in her hands, and we shall ask her to recognize those objects with her eyes closed. Okay, so please close the eyes. I shall be placing certain objects, and you should recognize what it is. Okay.
It's a coin.
It's a coin.
A pen.
Yeah, so it is a pen.
Key.
Yeah, so it's a key. So there is no problem. If at all there is a defect with the sensation, it is called as astereognosis. And stereognosis is also carried by the dorsal column tract. The sixth test is for the vibration sense. Vibration sense is the tingling sensation felt by the subject when the base of a vibrating tuning fork is placed on the skin overlying the bony prominence. The tuning fork here that we use is a tuning fork with 128 Hz. To tell the subject as to what kind of feeling it is, initially we will vibrate the tuning fork and place it over the sternum, and then that way the subject will know what kind of sensation is to be perceived. Once the subject knows what kind of sensation it is, we will place it on the bony prominences. Okay, and the person has to perceive the sensation. Also, the subject should say when the vibration sensation is stopped. Once the vibration sensation is stopped, we will place it on the same bony prominence on the examiner's hand, assuming that the examiner is normal and has a normal vibration sense. And if the subject has a normal vibration sense, the examiner will not feel the vibration sense once the subject has stopped feeling the vibration. Okay, so let's start. Okay. So to tell you what kind of sensation it is, I shall initially vibrate the tuning fork and place it over your sternum. Okay. Okay. So that is the tingling sensation that you feel. Now you can close your eyes, and I shall be keeping it on various bony prominences. So tell me if you can feel it. Okay, you can say yes when you feel it, and stop when it is stopped. Okay. You can keep it on any bony prominences like knuckles or elbows or patella, anywhere. Okay.
Yes. Stopped.
Okay, once it is stopped in her, I shall place it on my own knuckle. Now even I am not perceiving the vibration sense. That means the vibration sense in the subject is normal. If it is decreased, I will be making out. I can sense the vibration sense even after some time. So vibration is normal, and this is also carried by the dorsal column. It is hampered in conditions like dorsal column lesions, stapes dorsalis, peripheral neuritis, etc. Moving on to the last test, here we are looking for the abnormal sensations. These are various sensations felt by the subject in the absence of any stimuli. So for this you will have to ask certain things, whether you can feel any numbness anywhere,
No.
any itching,
No.
any pins and needles sensation.
No.
You feel like as if the insects are crawling over your skin.
No.
No. So there are no abnormal sensations. Now other than this, there are 2 points that we have to find out, that is sensory inattention and Romberg's test. Now for the sensory inattention, what we do is we would simultaneously stimulate on corresponding points on both sides of the body, and we will ask the subject whether he can perceive it at the same time or if he can perceive only on one side. Okay, now for this again you will ask the subject to close the eyes, and I shall be placing anything. You can do it with a touch sensation or pain or temperature, anything. Okay, here I am using the cotton wisp. Okay, so I shall be touching on certain parts. You have to say whether you can feel it on one side or which side you can feel the sensation. Okay,
Yeah.
alright, so please close your eyes.
On both sides.
Okay, so there is no problem. So in case of sensory inattention, the person will fail to perceive the sensation on the affected side. So if there is sensory inattention, that means the person cannot perceive on the right side. That means there is a lesion on the left side. Next we have to examine for Romberg sign. This test is done to know the integrity of the dorsal column. So what we do here is we will ask the subject to stand with feet closed, and then we will ask the person to close the eyes. Okay, so in case there is a dorsal column lesion or it leads to something called a sensory ataxia, the person will sway or he will fall down. Now as a precautionary measure, what we do is we will stand to hold the patient in case he is about to fall. So we should see to it that there are no injuries to the subject. This finishes off the examination of the sensory system. Thank you.